Hello, Guy. Thanks for joining us, and thank you for participating in this interview. So, for those who don't know you, so you're Guy Montgomery. So you work at the ICANN school at Mount Sinai Hospital. You hold two positions there. You're a professor in the Department of Population Health Science and Policy, and also you're the director of the Center for Behavioral Oncology. So that's impressive. If I'm correct, you completed your PhD in clinical psychology in 1995, and you're also past president of the American Psychological Association's Society for Psychological Hypnosis, so the Division 30.
Thank you very much for inviting me, Clement. I really appreciate it, and it's very kind of you. And 1995 sounds like an awful long time away, doesn't it? So,
To my knowledge, you have well passed the 100 peer review article mark, so that's quite an achievement here. And I cannot list all your achievements, otherwise it would take far too much time. But speaking of achievements, in your academic career, what achievement are you the most proud of, Guy?
I guess, in my academic career, I think I'm most proud of our clinical trial that we conducted with breast cancer surgical patients. And so it was a 200 patient randomized clinical trial. And we did a brief hypnosis intervention on the day of surgery prior to surgery. And for those of you unfamiliar, the surgical day can be very stressful for patients. And we were able to use some waiting time, while they were waiting to head to the OR and things like that, to do a very brief 15-minute hypnosis intervention.
Mhm.
And, we found, a lot of positive results, and I'll just highlight a few. The first is we decreased the stress prior to surgery. So the emotional distress that the patients were experiencing, and I thought that was super important on such a stressful day that we were able to bring some relief and help improve quality of life at that moment. And then, but then we kind of analyzed everything else, I guess, after surgery. And that's where we really found some very striking results. We found that patients in our hypnosis condition, and the hypnosis was compared to an attention control condition. Patients in our hypnosis condition had less pain following surgery, had
Mhm.
less distress, had less nausea, had less fatigue. And so those were all self-reported outcomes. We also found that they were in the OR area for a briefer amount of time. And we also found that they required less analgesics and anesthetic during their procedure. And then we did a cost effectiveness analysis. And what we found is the patients that were in the hypnosis group cost the institution about $772 less on average
Wow.
than patients in our attention control group. And so I really saw that as a big win, I guess, in that we were both able to demonstrate, empirically the difference between the groups and the effectiveness of hypnosis, but then also, have a real world example of how these kinds of talking interventions can be effective and cost effective, and in reality have a cost savings associated with them. So that was pretty cool. That might have been my drop the
Wow.
mic moment. So I guess I'm very proud of that.
Wow, that's indeed pretty cool. So not only quality of life improvement, or not only subjective improvement, but also like quite striking effects on pain, nausea, and things like that. Wow, that's indeed pretty cool.
Yeah, the
Um,
effect sizes were pretty good, in the moderate to large range pretty consistently.
hmm,
And so I was very happy with that. It was, one of those rare instances where the science and the clinical impact came together.
hmm. Well, especially in a condition where you can have a lot of stress and also a lot of symptoms, that's that's great. So that's more or less the one impressive result. But where did it all start? What started your interest in hypnosis in the first place, or in response expectancies in the broader sense?
I've always been interested in how, what you think affects how you feel and what you do. on a very, straightforward level. So how does how we're thinking affect our experiences and our behaviors? And, that's kind of where I started. And I had this very unrefined and undisciplined interest in this area. And then I happened to start working with Irving Kirsch in graduate school, and really benefited from that tremendously, and thinking a lot about response expectancies. And obviously, Irving was the person who first wrote about them and coined the term, and showed their importance. And so that really got me going. And I did some placebo analgesia studies back then with Irving, and showed how it was really important what people were thinking as far as the pain relief from a placebo that they experienced. So that kind of started it going. And we would talk a lot, and then we would talk a lot about essentially as hypnosis as a way to manipulate expectancies. And so that, that kept me going, and in a way to change expectancies without being deceptive, right? So placebo is by its nature deceptive. You're not telling someone the full story at the very least, right? I've heard this phrase recently: you're being economical with the truth, right? And so
Good way to put it.
yeah, right, right. You're not saying everything. And so, that was very interesting and important to me to learn more about that, but also to take this mechanism and bring it to essentially people in need. So to make it, to take the science and how do we translate this into clinical impact to help people. And that's always been a driving interest. And so that's what got me going into hypnosis, is that using hypnosis as an effective way to change expectancies in clinical settings to improve individuals' outcomes.
So yeah, that's one thing that's really I found fascinating about your research, the bridge between experimental hypnosis and the clinical setting, and how you're really linking the two, and taking the most part of each. Speaking of which, do you see any key differences between experimental hypnosis research and the clinical setting, the practice of hypnosis?
I don't I don't think of it so much as differences, but as two sides of the same coin in a way that inform each other. The experimental research is necessary in order to better understand the phenomenon and think about what are the underlying mechanisms of hypnotic phenomena. But then also the clinical work is critical because it informs our science, right? And it's almost like a circle, like we want to understand this. We want to understand it so we can help people. And so we think about, well, what's the problem, particularly in my group? What is the problem that we're trying to address? What's the clinical need? How can we improve cancer patients' lives, right? And so we think about that and we say, well, what are they asking for? What are they, saying that, is bothering them? And then how do we understand that? And then how do we devise an intervention to intervene to improve, right? To have better outcomes. And so I think they're both very important. And I think, one without the other diminishes both. You need them together. It's like I guess it's like peanut butter and chocolate. They're better together.
Sure. Yeah, and it's not knowledge in the abstract. It's for relieving suffering from the patients. So I find that cool. Yeah, and also the other way around, how practice informs research and guides some hypotheses too. So yeah, I really 100% with you on that.
Yeah, in our group, we often say that our best ideas come from the patients.
Yeah, sure. Yeah, sometimes they say things that make us scratch our head and say, puzzling but interesting.
What can I do here? Yeah.
Yeah. Um, okay, and where did it lead this loop between practice and research? Where would you what would you describe how would you describe your theoretical orientation toward hypnosis? I guess it's shaped by your experience and that loop we just discussed between the theory and the practice.
You know, I am I guess a very devout sociocognitive theorist for the most part, and I think about hypnosis in the tradition of that it's the things that we can always do, right? It's things that hypnosis is within the normal experience, right? And it's just we're using hypnosis as an intervention to get at mechanisms that help us achieve outcomes.
Mm.
And so I know some of my hypnotic state theorist friends, don't appreciate that, but that's okay. I think intellectual differences are, kind of, what helps drive the field in all of us and makes it better. And that we
Mm.
get to think about problems from different perspectives and ask questions and then try to test and address those questions in our studies to see, can we learn more about what's going on with this, very terrific technique.
Yeah, cool. I'm a big fan of sociocognitive theories of hypnosis, but maybe could you say a word or two for the the viewers that are not too familiar with this approach? Maybe what distinguishes that from other views of hypnosis, or maybe it's too long. Tell me.
Well, I think just very briefly, it's it's the sociocognitive theory is saying it's what you think, it's what you expect, it's what you believe, and it's how you feel, and that's what's comprising hypnosis. Whether how you're feeling when someone's conducting a hypnotic intervention with you. And I guess that's opposed to state theorists that say the brain is in a special state when hypnosis is applied, particularly those that are very good at hypnosis, or they've sometimes been referred to as, uh, you know, uh, hypnotic virtuosos, let's say. And so, and thinking about it that way, that it's some kind of brain change
Hmm.
versus it's some kind of um, sociocognitive process, maybe involving beliefs, expectancies, hopes, things like that that lead to change.
Hmm.
And I think the sociocognitive is particularly useful in clinical settings because most people, when we test for hypnotic suggestibility, are in the middle, right? There's only very few of us, or that are very good or exceptional at hypnosis, a virtuoso. And so, we want to try to bring the clinical gains and the benefits to the vast majority of patients, not just those few patients that can excel in hypnotic contexts.
Yeah, sure, sure. This most people are average.
Yeah,
That's true of many things.
most people are in the middle.
Yeah. And speaking of that, there are some research uh, going in the sense of improving responsiveness to suggestion, which is highly impactful for practice. What do you think about this kind of research, the direction?
I think it's really neat. And I think, research showing that you can improve hypnotic responsiveness, is kind of, I think, aligned with this sociocognitive view of hypnosis.
Mm.
I think hypnosis is special in a lot of ways, and that retest correlations on your hypnotic ability, let's call it, are very high, right? And I think it was Hilgard that published like 25-year correlations or something like that. Um, and so I think that it's something that you don't like for a person that's hypnosis naive, let's say, it's something that you kind of learn about and you learn about yourself and your responsiveness to it when you do it, right? When you participate. And I think the expectancies for how well you're going to do get very set at that time and that initial encounter and then carry forward. And
Mm.
so if we can improve that initial encounter, we might help people be more responsive to hypnosis in the longer term. So I think that's very exciting research. There have been a few studies that have shown that you can get higher scores. And I think that it's something that can be done clinically, but also it depends on the clinical situation. If you're seeing someone for a one shot, let's use hypnosis to control pain. prior to your medical surgical procedure, you might not have a lot of time, right? You got to do it now.
Mm.
Whereas if you're seeing a patient over repeated sessions and working with them, you might have more time to do setup, essentially.
Hmm. Nice. And so that would imply also response expectancies, I guess, the way the fears the patients brings into the session, or the hopes, as you mentioned, the everything, all the background, all the beliefs on hypnosis, and the maybe the own capacity of the patients. Um, Beyond response expectancies, in what other ways do you think hypnosis shapes patients' experience, or experience of participants in an experimental setting, for example?
I think in both experimental and clinical settings, what I've noticed is that um, I think it also has a big contributing factor through reducing, I'm going to call generally emotional distress or distress, right? It could be
Hmm.
some anxiety, it could be bad feel, sad mood or whatever. But bringing relief to that in the moment, I think, is also a mechanism that helps improve outcomes. So, an easy example is we have, let's say, a student that's studying for a big exam, and prior to the test, they're very anxious, right? And
Hmm.
so we use hypnosis to reduce their anxiety, and they do better on the test, right? Because the anxiety won't interfere with their test taking ability
Hmm.
and won't get in their own way. In clinical contexts, if you have a big procedure coming up, or you're worried about something in particular in your diagnosis, you're likely to do better. And by do better, I mean less side effects and symptoms, if you're less distressed going into that. So I think that's also an important mechanism, in that
Hmm.
essentially turning down the volume on individual distress can lead to better outcomes as well. And there's a long literature, I think, for example, in pain, where being more anxious leads to greater pain reports. I think
Hmm.
also in fatigue reports as well.
So not only the high-level beliefs and representation, but also more somatic variables like arousal,
Yeah.
or stress, or yeah, nice. And I believe the two are linked and influencing each other.
Yeah, yeah. Have you ever been in like in a medical context, or maybe the dentist, where they're like, "This is really gonna hurt." Well, then it's really, it's gonna hurt, right? You're like, "Oh, don't tell me that," and so
Thanks for the
they don't.
suggestion.
Right, yeah, they're using the suggestion in the opposite way there. And so
Hmm.
we want to use our powers for good and not evil, I guess. Is kind
Hmm.
of
Maybe that could bring us to to how maybe response expectancies are also active way beyond the context of hypnosis. And I believe that's one of the strengths for the sociocognitive model, that maybe you can use the mechanisms implied in hypnosis, maybe to cause yourself harm.
One of the things we did in our research program is, before jumping in with the interventions, we demonstrated the links between expectancies for symptoms and side effects associated with cancer and its treatment, without intervention, right? So patients that were scheduled for, let's say, chemotherapy, we'd ask them, how much nausea do you expect to feel?
Hmm.
Associated with your chemotherapy infusion. So we were able to empirically show the relation between expectancies and the outcome of experiencing of that side effect. And then, kind of using that, having that data on hand, we were fairly confident that that was an underlying mechanism. And then bringing in hypnosis to
Hmm.
address and modify the response expectancies for those outcomes, we were very excited about, as kind of a proof of principle, that not only does it work, does it help patients, but this is this is at least part of the underlying mechanism.
Wow, nice. So something like countering the nocebo effect, or something along
Yeah,
those lines, right? Or
right. If you're going into something thinking this is going to be the worst thing possible,
mm,
sometimes we tell ourselves that, what do we do? Prepare for the worst and hope for the best. So it's not like a pure
mm.
expectancy there, but what are you really expecting, and can we change that a little bit to help you have a better outcome? And most people get that right away.
Nice.
especially when you use real life examples.
Yeah, sure. That's very telling. Um, okay, and let's say for a minute that you have unlimited funds to conduct whatever research you want, uh, and you could do the study of your dreams. What would you do with all that money and time to conduct the study of your dreams?
I guess if I had unlimited resources and can do the study of my dreams, I think I would really, I don't know if I could narrow it down to one. One
Mhm.
thing I've always had a lot of interest in is, I know David Spiegel did some work early on with
Mm.
hypnosis and groups in metastatic breast cancer patients, but I think the metastatic group, I think after those studies has received less attention. And I think they deserve more attention because many of them can be at the end of life.
Yeah.
And hypnosis as for providing analgesia could be super important because maybe they want to spend time with family, with friends, doing things they want to do rather than having to deal with significant pain with the use of narcotics, which can obviously give pain relief, but also come with a host of other side effects, feeling loopy and not being able to be present with people being
Mm.
foremost. So I'd really like to do that study and do it kind of, I hate to use the term, but in the modern world today, where those original studies were conducted, in group settings and people showing up. I don't know about in France, but in America, a lot of people don't want to show up in person for things anymore. It's like a weird lesson we took from COVID. And so is there a way to deliver hypnosis to these patients in a convenient way? And the other part of it is they're pretty sick, right? So they don't want to come to the hospital for this extra appointment. So
Sure.
can we deliver hypnosis as a distance using video conferencing technologies and things like that? Is it as effective? Maybe it'd be neat in the study to have an in-person arm, a group versus a video conference group and see who does
Mm.
better. That would be a lot of fun. But I think that's an important area for study. Another area where if I had unlimited funds is I wanted to devote more research to how to train people in hypnosis and
Mm.
how to do it in a way that's useful for them. And most importantly, that they can then use it with their patients, right? And so um, if hypnosis has this, history, right, of I refer to as questionable connotations and kind of interest in hypnosis can wax and wane, right? And it kind of comes, it kind of goes. It's in a movie. Dracula's using it, whatever, right? But how do we train people to both address those issues
Mm.
and then also show them that, hey, it's not scary, it's not spooky, and it works. And you're going to be just great using this with your patients. And so I'd like to study more how to train people, right?
Mm.
How to train them in a way that helps them not only feel confident in the procedures but able to do it in real life, right? And it was,
Mm.
I think, the only way we're going to disseminate this intervention, which, I think we're both big fans of, is to give it away,
Sure.
right? Right. Yeah. And so I think by doing these kinds of trainings and giving it away, I think we're going to be not only reach more practitioners, but then exponentially more patients.
Mm. Yeah, nice. So, if I understood correctly, there would be the part on more focused on the patients and how to improve their quality of life, enabling them to have maybe some more meaningful time with their families at a time where it could be really difficult for them. And also the part on the training, which would be really nice to disseminate the techniques to a lot of people and uh, in uh, in the end touch way more patients and help so many lives. So yeah,
Uh,
that's great.
The
Tell
other
me
thing that's
everything.
got me interested is, have you seen some of this work with psychedelics and like ketamine research
Yeah.
and things like that? I'm really strongly wondering, like, what's the role of response expectancies in those
Mm.
outcomes? And could we use hypnosis, for example, to shape the outcomes associated with taking psychedelics in those kinds of situations? I don't have any data,
Fascinating.
but I think that would be a fun study to run, because I bet it's true.
Yeah, sure, sure. Completely agree. I have some friends working on that, by the way,
Oh, really?
and
Oh, that's really great.
yeah, yeah,
Yeah.
it seems pretty cool.
You should give them some of those funds we just discussed.
I will, I will.
Okay.
Imaginary phones are cheap. But yeah, that would be a great study, great study. So as you know, I'm still in my early years as a researcher. I didn't get my PhD in 1995. I was still a young child at that time. Uh, but what would you give? What advice would you have for someone starting a lab on hypnosis? A certain someone.
Certain someone. My first advice is be brave. Uh, it's hypnosis has not only a very long clinical history, as you know, a very strong empirical research history. And I think that it's often overlooked due to fantastic claims about hypnosis and movies where people use hypnosis to take over small towns or something like that. And so, but it's, I guess, a lot of times, we've been talking about hypnosis as the good kid with the bad reputation. Okay. And I think it captures a lot of it, is that sometimes you have to do a little extra work to get people past what their initial impression is. That in that initial impression may be negative. Oh, that's something that's just silly in the movies. Oh, I saw a stage hypnotist or whatever, right? And so, but if you can get people past that and see both the science and the clinical impact, I think that a new lab in there is going to do terrifically well. So I guess my first recommendation is don't let initial obstacles stop you. All right. You have to keep going. And, they're going to be a little different with hypnosis than other areas of study, but you have to get past those. And you can know that you can get past those. And then number two, I think, is never forgetting the excitement of hypnosis. It's neat, it's fun, it's a way to help people feel better, across a wide variety of outcomes by just talking to them.
Hmm.
Right. And if you said to somebody, look, if I, talk to you and you don't even have to answer for about 25 minutes, how do you feel about that? Want to give it we could give that a try. I'm pretty sure it's going to make you feel better. Most people say yes. Right. And so I think keeping the excitement about
Hmm.
hypnosis, I think, is important. And I think that's what brings our whole community together, is that, remaining optimistic and excited, and how can we best, learn about this intervention and then apply this intervention to the betterment of both knowledge and our patients.
Wow. I try to remember that.
Well, that was a mouthful, right?
Yeah, yeah, but I think that resonates with a lot of ideas I can have for research and especially why we do research. And I think a lot of things you said today are coherent with that end goal, which is relieving suffering, and in a cool way,
Yeah.
an unexpected way, often misunderstood way also.
Well, I think that's it, is remembering that.
Hmm.
What questions about, in starting a lab, what questions about hypnosis excite you? What do you
Hmm.
find really interesting? And then you're going to be passionate about pursuing that. And, keep the fun in it.
Thanks. Uh, Maybe one more question. I would have 100 of them, but maybe one more. So you have a long experience both in clinical hypnosis and also in basic research, or I would say in experimental hypnosis more. Um, what would you personally like to see as some future directions for experimental research, or maybe for clinical research also? So you said some words on what would you do with unlimited funds, what would interest you personally, but what do you think are some future directions for the community, for this research community on hypnosis?
I think, what I'd like to see are some experimental studies that, similar to what I was just saying, acknowledge that hypnosis is pretty cool, right? And that it's, and I'm putting it very, I'm using, very common language here, but that understanding hypnosis, whether it's from a, kind of a state theory perspective or a sociocognitive perspective, it doesn't mean that we're trying to dismantle hypnosis in a way that takes away the fun, the magic, right? And it's still important. And so I think thinking about that and thinking about, yes, it's important to find, the questions are for who does this work best, right? So what patients, but also remembering that weirdly, hypnosis seems to work for the vast majority of patients. When we use meta-analyses and things like that, we typically find, medium to large effect sizes across a variety of outcomes. And so remembering that, yes, there may be this group of people that are super good at it, but that doesn't necessarily mean hypnosis should exclusively be in that domain. I think it's more disseminable and more applicable in many, many different contexts. So I think that kind of work, talking about, yes, for who does it work best and for how does it work best, but also understanding that we can have a broader application. And then, I never really studied, I did study, I should rephrase this. I did study neuropsychology a little bit back in the day, back in those early dark ages of the 90s. But also, yeah, like there's a lot of studies on brain changes associated with hypnosis and hypnotic states. Right, that word is commonly used. Look at that, it almost got stuck in my mouth. But where else would we expect there to be changes, right? There's changes in our brains when language is going on, right? There's changes when we think about things or performing a behavior or a physical movement. So it makes sense to me that there's changes in the brain, when we're using hypnosis, right? And so, but so just to me, I guess that doesn't necessarily mean that it's a special brain circumstance and involved in hypnosis. It might be true, but it might not. I don't know. And so I think always keeping an open mind with our studies and our outcomes and different ways of looking at things will help our understanding and keep the research really interesting, right? We found this. We think it means that. Okay, let me try that study in a slightly different way and see what else we can think. I think, I think that's what's going to help promote the field and promote the growth and our understanding of, what is hypnosis and how does it work?
Nice. Thanks. I have this feeling of about the hypnotic state or hypnotic states. It's just like we discovered some weird people doing mathematics, and we study them, and we say, oh, yeah, when they do mathematics, they are in this mathematical state, and yeah, maybe we spend too much time trying to identify the mathematical state and not enough time looking at how they do math, basically, and how to do good math and how to fail at doing math.
Yeah,
What do you
that's a
think? What
great
do you feel
analogy.
about that?
That's terrific.
Yeah, so thanks so much for yeah, this is discussion and what you bring to the field. And yeah, thanks for your time.
Thank you very much. This has been my pleasure. And I very much enjoyed speaking with you today. And I think that, maybe we could do something again.